It's another day with the physicians where your health is our business. With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that not only when your pressure is high that you have glaucoma.
And I don't know about any other one, but what you know is
You're welcome back to the training culture of your regular program. Now, I would narrow down and say that maybe there are 3 core lessons to take away from the pandemic. The first one is that we should learn to prioritize our health. Prostate cancer is cancer that occurs in the prostate. The prostate is a small walnut-shaped gland in males that produces the seminal fluid that nourishes and transports sperm. Prostate cancer is one of the most common types of cancer and the second leading cause of cancer death in men. Many prostate cancers grow slowly and are confined to the prostate gland, where they may not cause serious harm. However, while some types of prostate cancer grow slowly and may need minimal or even no treatment, other types are aggressive and can spread quickly. The incidence of prostate cancer increases with age. Some studies actually have shown an overall 2 to 3-fold increase in the risk of prostate cancer in men who have a history of this disease in their family. It is more significant if a family member was diagnosed with cancer at a younger age, let's say less than 60 years of age. And of course, on your regular program, the physicians will be treating prostate cancer, the risk factors, symptoms, causes, and management. Don't go away, just stay tuned. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, your usual anchor on this program. Today we'll be discussing prostate cancer, the risk factors, symptoms, causes, and of course the management. And with me in the studio is a consultant, a very versatile one. He is the head of department of radiotherapy at the Lagos University Teaching Hospital. He is also the lead oncologist in the NSIA-LUTH Cancer Center here in Lagos. He is no other person than Dr. Habeeb Muhammad. Doctor, you're welcome to our program.
Thank you very much.
After the chasing, running around, trying to pick you, get you to be on the physicians, I'm glad you finally made it here because of a very busy schedule. Yeah, I really appreciate that you've made it here today.
Thank you.
We're talking about prostate cancer.
Yep.
And we know it's one of the leading common causes of death, the
Yeah.
second leading cause of death in men.
Yeah.
So, do you just want to give us a general overview of the prostate, its location?
Yes.
Then, before we now talk about cancer, what is cancer? What is the prostate? What does it do? Why is it important that we discuss prostate cancer?
Okay. First, I would like to say that it's actually the first most common cause of death in Nigerian men. Overall, worldwide is second, but in our own population, for men, it's actually the first.
Wow.
Because we don't have lung cancer as common as it is in other
places.
climes.
What?
Exactly.
Okay.
Yes. So the prostate gland, like you rightly said, is a walnut-shaped organ, but it's at the base of the bladder. That's at the neck of the bladder, rather. It's at the neck of the bladder. It's going around the neck just like the tie is going around my neck.
Okay,
yes, exactly.
So it goes around the bladder.
Exactly.
Okay.
It's about 20 to 50 milligram in weight. Okay. And the major function of the prostate, like you rightly said, is to provide semen for sperm.
Okay.
And to, there are some other enzymes in it that allow to nourish the sperm and all that. So usually the prostate gland gets enlarged with age.
Okay.
And also, as it's around 40 years of age, we start seeing the manifestation of either enlargement or abnormal growth, which we call cancer. So most of the time, as from 40, as we grow, that's men, we start having these urinary symptoms like frequency, like exitance, where frequency that's going to toilet most of the time, feeling like you have not completely emptied your bowel, or painful urination, poor stream of urination, and all that. It is said that in autopsy is what you do, the examination you do on dead bodies. Okay. It's said that 80% of men that are 80 years old have prostate cancer. However, most of them are not aggressive, so they are not detected while the patient is alive. You understand? So prostate cancer is largely related also to race and our way of life. Now, black men have higher tendencies to have prostate cancer, and we also have more aggressive form than the Caucasians.
Is there any reason for that?
Well, unfortunately, the reason we don't know yet, but we know that in general, many cancers, even including breast cancers, they occur a little earlier in blacks than in Caucasian, a decade earlier. And because they are occurring a decade earlier, they're usually more aggressive, giving it poorer outcome, or what we call poor prognosis. Because of the aggressiveness, because of the lack of facility, lack of personnel, and lack of health programs that help us catch it early. So most of the time, we have poorer outcome, which is called prognosis. Prostate cancer is a little different from prostate hypertrophy, what we call benign prostatic hyperplasia. Yeah, which can confuse, which we can confuse.
Absolutely.
Both for BPH and prostate cancer, they can manifest with increase in what we call PSA. PSA is a chemical in the blood, which is actually called prostate specific antigen. So anything that affects the prostate can increase this in the blood. We use it as a tumor marker. What do I mean by that? You can use it to follow patient up to know whether they have prostate cancer, or if they already have, to trace the management to see if you are winning the management or if the prostate cancer is progressing while you are managing. So BPH is benign. It's not cancerous. So it's just enlarged. It will not invade the surrounding structure. But prostate cancer has the ability not only to invade the bladder, it will invade the structure in front of the bladder, it could invade behind the rectum behind it, and it could even spread to other organs.
Do we just want to talk about the symptoms? How does someone who has an enlarged prostate, whether benign or malignant one, how do they present? What are the symptoms?
Okay, like I said earlier, the prostate is at the neck of the bladder. So as it enlarges, the first thing it does is to kind of obstruct the flow of urine. Okay. So most of the symptoms you first see are those related to obstruction of flow, which are frequency of urination, that person goes to toilet to urinate because when it goes, it only urinate a little.
It doesn't void completely.
It doesn't void completely. So it feels so fast, it goes back, especially at night. Because at night you are not doing much, so it disturbs the sleep. So you are aware that wake up to, there's frequency, there's what we call hesitancy.
Okay.
That is, the person gets there because of the pain, which is also one of the symptoms, dysuria. The pain, the person, is
trying
not
to wait.
Exactly wait, doing it very cautious of passing the urine. So that's hesitancy. And then at times, if it is cancer, it could have invaded some part of the bladder, then you start seeing blood in urine. Yes. So you have what we call hematuria, which is blood in urine. Then at times, the person gets to the toilet and fails to urinate. That is very problematic. That has acute urinary retention. It goes to the toilet, but you are pressed, but you can't pass urine. And it's very disturbing. It's very agonizing. Usually, that one you relieve it with a urinary catheter. Usually, you must put a catheter. And even in such patients, to cannulate or to put the catheter is usually more difficult than the normal. Yeah, because of the obstruction. So it takes somebody who is very skilled in cannulating such a patient. Otherwise, you'll just be meeting obstruction, you understand? So usually the urologists are very good in cannulizing that. All these are for patients who have just, the cancer within the prostate or just around the prostate. But usually it could spread to the hip bones and the patient starts complaining of pains around the hip. At times, you have relatively advanced case with spread to the spine and everything before the patient knows. Patient will be taking antibiotics and taking analgesic more, and treating something else, treating arthritis. Meanwhile, it is prostate cancer. That is
self-medication without even knowing the diagnosis.
Most of the time.
Just hold it there.
Yes.
When we come back, we'll talk more on some of the risk factors and the possible causes before we go to the management.
Okay.
I'm sure you've been understanding what our consultant, the guest, is talking here about prostate cancer. He's told us a whole lot. The risk factors, he has mentioned some, even though he's still going to talk more about it. He has also talked about the age, from where it starts, from age 40, and different kinds. You can have the prostate being enlarged, it can be just a benign enlargement, which is called the BPH, benign prostatic hyperplasia, or it can become a real malignant type. So now let's hear what you have to say on keeping up with the physicians on prostate cancer. We'll be back after this short break. Stay tuned.
Yes, of course. It's a common thing amongst men.
Yes, definitely. It's a term I've heard of.
It's located at the glands in between your abdomen, your lower abdomen.
In the reproductive organ of a man.
Yes, I think in the private part, lower parts of the private organ.
Prostate cancer can be hereditary and it can be caused by the type of food you eat.
I don't know.
Just like many other cancers, I don't think their physicians have come up with any known means or what causes it. As far as I know, I think research is still going on. But I want to believe with the kind of maybe the radiations that's going around or what we eat sometimes, or sometimes it can be hereditary or age-related.
Men that is above 40 years.
People that are likely to have prostate cancer are men, because mostly it affects men.
I think men of age above 40.
Welcome back. If you have just joined us, you're on to your regular program, The Physicians, where your health is our business. If you were in part of this program from the onset, I can assure you that you have actually missed a whole lot. But then you will always catch up with us wherever you have met us. We'll be discussing prostate cancer. And in the studio with me, we have a consultant clinical and radiation oncologist. He is Dr. Habeeb Muhammad. He's also the head of radiology department at the Lagos University Teaching Hospital and the lead oncologist at the NSIA-LUTH Cancer Center. Doctor, before we went on break, you actually said a whole lot about the symptoms. Now, in talking about the causes, we talked about the risk factors, okay? Apart from the familial history, that if it runs in a family, what are the other possible causes of cancer? Cancer.
The most important factor is being a man.
Wow.
Because, and then aging. A man that is aging, that's a male aging, that's the most important factor. We know that the only men that do not have prostate cancers are those that are castrated while in their childhood. Once you are a man and you are growing up, as you grow older, you are at risk of prostate cancer. Yes. Everybody is at risk, or every man is at risk of prostate as they grow old. So only that those who have familiar factor, they have the likelihood of having it earlier, and the chances also increase, of having it. But men, once you are a man, you have a chance of prostate cancer.
So being a man makes you vulnerable to having prostate cancer.
Being an aging man.
An aging man.
Yes.
So from age 40, is it advisable to start checking?
Exactly.
And if there's a familiar history, from age 30, it's also very advisable.
Yes.
Now, you already talked about some of the diagnosis, how it's diagnosed.
Yes.
How you already made
diagnosis? Yes. Diagnosis. It is more beneficent if we diagnose prostate cancer from screening rather than from symptoms, because a patient that has symptoms means that there is already a sort of progression, there's already advancement, because the symptoms is as a result of damage to normal structure. So when prostate cancer is confined in the prostate, usually there is no symptoms. Yes, we can track it by screening, and the screening is the use of PSA. That's the screening the blood with for rise in PSA, which normally is between 0 and 4 nanogram per ml. Then doing a digital rectal examination to be sure that the architecture is normal. Then using an imaging procedure like ultrasound scan to scan the prostate. However, at times, patients present late with all what I've said, spread to the bone, numbness, low blood, pelvic pain. The real diagnosis is made with biopsy. Yes, you take a biopsy, then with the biopsy, you'll be able to see that we have malignant cells in the prostate gland. Then also, from the biopsy, you'll be able to grade what type of cancer this is. Yes. Then staging is done using imaging, because staging is how far has it gone, while grading is how aggressive is it. Wow. So with histology, you see how aggressive it is, but with your imaging, you see how far it has gone, which is the stage. So we have grade from histology, we have stage from examination, imaging examination. Now
you have told us so much about how this very important organ in the male can actually become cause a lot of challenges, problems, or an individual, the man, who is not actually aware of it. You've told us a whole lot. So now people are, I'm sure my viewers are there with their bios and the papers, and they're listening. They're talking about the possible causes, the risk factors. So how can this be? What are the treatment options?
We have myriad of treatment options. The first thing is we look at what encourages prostate cancer. It is being a man, the testosterone, that's the male hormone. So it has been found that if you block male hormone, then you can starve the prostate cancer. However, most of the time, over a time, they become resistant to blockage with anti-hormones. So we can also introduce chemotherapy, which is cytotoxic drugs. What I mean by that is that drugs that can kill abnormal cells. So we can use chemotherapy also for prostate cancer. There are other drugs, other very advanced drugs that we can also use. However, if the prostate cancer is within the prostate, if we catch it very early, there are two treatments that we can give. We can either remove everything en bloc, what we call radical prostatectomy. That's you are taking the prostate with the cancer away. Or we can do radiotherapy. That's using ionizing radiation to annihilate the cancer cells. We burn off the cancer cells from the prostate. These are the major ways we treat. So either with drugs, anti-hormone, or with cytotoxic drug, chemical drugs, or we do surgery to remove it, or we do radiation to burn it off. Radiation can also be used to treat symptoms of side effects. That's to treat symptoms of advanced stage, prostate cancer. That if it is spreading and it spread to a bone, you can irradiate the bone. If it is backbone, you can irradiate the backbone. If it is causing excessive bleeding of, blood in the urine, you can irradiate
all these are just palliative.
Yeah,
right?
palliative treatment. You can use radiation for palliative treatment too, apart from radical treatment. Radical means intention to cure. If you want to cure, if you catch it early, you can either remove it radically or you use radiation to burn it radically with an intention to cure.
What is the survival rate?
Yes, survival rate, just like every other cancer, will depend on several factors.
The stages?
One, the stage. Two, the grade. These are the two most important factors. Then comorbidities. Are there other diseases? For example, if there are other debilitating diseases, it makes the person not strong enough to withstand treatment. So it will affect, then availability of, expert personnel and, the facilities to do this treatment, will also affect, However, the summary is that if you catch prostate cancer very early, what we normally would term stage 1, then survival, 5-year survival rate is about 90-something%.
Wow.
But if you have a stage 4, which is the end stage prostate cancer, where it has spread to all parts of the body, then 5-year survival rate will drop to less than 5%.
Okay, so how can this be prevented? Just
Screening.
Screening.
We screen. Once you are up to 40, you should screen. It's not too difficult to just take the blood sample and do a PSA, or just go to specialists, let them do digital rectal examination, or we do ultrasound scan. You check the prostate with it to see the architecture of the prostate with ultrasound scan.
Okay, so how about for people to be able to manage at home, those that actually have it and those that need health care? I know very well that there is the NSIA-LUTH initiative. Do you want to tell us more about that center, if it's also where people can also...
NSIA is a state-of-the-art cancer center. It's an international cancer center where you have also expatriates working there so that we can meet the international standard with collaboration with many other international, cancer centers in Europe and in North America. NSIA was established in 2019 June, February 2019, sorry, by His Excellency, the President of the country. And what NSIA did in NSIA did in the cancer center was to upgrade the existing radiotherapy department of LUTH. That's by improving the building, increasing personnel, bringing personnel from outside, also from IAEA, that's the International Atomic Energy Agency, which is an arm of UN, to come and train the local staffs. Wow. Then we also have some of them working with the local staff so that there's continuous transfer of knowledge. Then we have new machines, new state-of-the-art machines, and we have like 3 teletherapy machines. Teletherapy machines are machines that you can use to treat cancer, that can treat a wide range of cancer. We also have high-dose rate brachytherapy machine. This center, with all this, is the most equipped center in sub-Saharan Africa.
Really?
Yes, it's the most, and we already are having some patients come up from abroad to the center for treatment, because treatment here is international standard, but it's much cheaper compared to what it is in most parts of the world. So Nigerians from outside, some of them that know about it, They are coming. And some patients, some Nigerians that travel abroad, they tell them there that we have a center where you can do follow-up. It's an international center. It's in Nigeria. It's in Lagos. And they refer to...
In Nigeria, in how many places do we have these centers?
Well, NSIA Center for Cancer is only the one in LUTH. However, NSIA has other centers which are not for cancer, they are primarily for cancer.
Okay, so even everywhere from the north, the east, they all can actually come to...
They can come there. Yes, they can come. We have government centers for radiation treatments in some of the teaching hospitals, but this is the most equipped. This is the most equipped, yes.
Thank you very much, Dr. Habeeb Muhammad. It's been nice having you as our guest on this program. I'm sure we'll call again so that you can enlighten us more on other cancer-related topics. Okay, thank you so much. We really appreciate you. The physicians are very, very grateful. And I'm sure our guests, our viewers out there are also very happy and they are well schooled from this particular topic. So my dear viewers out there, I'm sure you actually enjoyed today's topic, prostate cancer, the symptoms, the risk factors, the presentation and the management, and of course the treatment. You know, the prostate is very important to everybody, to the man, to the woman, but it's found in men. And he has just told us also that it's the leading cause of death, cancer death in men in Nigeria. But in the world, prostate cancer is the second. So we must be very, very careful in ensuring that we have a healthy prostate. From age 40, it is advisable that you always go and do a medical check. Your annuals, check the prostate. But for those that have a familiar history, maybe the father, the grandfather had a cancer of the prostate in the past, from age 30, it's advisable that you also check it. The symptoms, like he said, if you have the prostate actually can actually enlarge, can be benign, it can be malignant. That is, it increases in size from age 40. It's not all the enlarged one that is malignant. It may just be benign. But then some of the symptoms that come with it from what he said is the stream of the urine. It doesn't form that arc when you urinate. There's also hesitancy and there's also urgency. It can actually also spread to those local surrounding so organs that are there. So try as much as possible to do an annual check from age 40 for those with a familiar history, from age 30. So on this note, I want to say thank you so much for keeping it there with the physicians as always. And inshallah, same time next week, you do not miss an episode of The Physician. Stay tuned so that next time when you call on your people, everyone will be able to look forward, to be able to watch the program, because we always look forward to having you there because we are always very excited. If you want to be part of this program, we're just a click away. Ensure you send us an email. And do not forget to follow us on all our social media handles. We're on YouTube, on Facebook, and on Instagram. If you have ever missed any of the past episodes, don't worry. You can always watch that on our YouTube channels. Till next time, stay blessed. I'm Dr. Martina Agberian.
Hello everybody, my name is Yewande Adekoya. I'm a pharmacist, a wellness and a lifestyle coach, and I'm here on The Physicians talking about self-care. Self-care is taking yourself seriously, putting premium on yourself and living an intentional life. Thank you for watching The Physicians.